Welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm here with my friend Bill Russell this week for an amazing discussion. Bill, do you want to give a brief introduction of yourself before we get started?
Sure. Bill Russell, former CIO for a 16-hospital system. And since then, I left, started a media business called This Week Health, and that has grown. And we've also started the 229 Project, which is about bringing healthcare leaders together for dynamic and real conversations about the challenges that they face.
I was so delighted when I discovered This Week Health. It is such an amazing resource. And you've teed me up really nicely because the first question I wanted to talk with you about was talk to me about your journey to CIO and then beyond. So I'm curious to know, when you were first starting out in your career, how did you envision your career going? Has it taken the direction you expected or not? And then I want to talk about podcasting too.
You know, it's interesting because I get asked, I do a lot, I have done a lot of coaching, I've done a lot of career mentoring and that kind of stuff. People say, well, you know, did you always know you wanted to be a CIO? I'm like, not a chance. And by the way, there is no one path to being a CIO. When I came out of college, my father said to me, hey, whatever you do, make sure you love it because you're going to spend a lot of time doing it. And he goes, what do you love doing? I said, well, I love computers. This is back in the day when computers were new, and I love technology. And I talk to people in both places. And when I talk to somebody so when I talk to somebody about golf, they said, hey, if you like playing golf, go make money working with computers and play golf. I said, all right, that's what I'll do. One of the things, you know, for me, and it's a little different, we have a lot of physician CIOs and others today. I literally started from the ground up. I started working on a help desk, and then I became a system engineer. I installed networks all over St. Louis. I grew into a consultant. I did work. I joke with my early career was I did consulting for about 20 years before I came into healthcare, and it was beer, banks, and bombs. Anheuser-Busch, Bank of America, Boatman's Bank, others like that, and then bombs was like McDonnell Douglas. You know, I mean, those were the kind of companies that would bring me in and say, you know, what should we do here? And typically around technology. So I did consulting for a long time. That led to me starting my own business, and people said, hey, would you be an interim CIO for us at a university? And I did that for three years or so. And that's the cushiest job in America, is being a CIO for a university. And I hope somebody who is a CIO for a university hears this, because I've now been a CIO for several types of organizations. Healthcare is far and away the hardest job I've ever had in my life. And I've managed, as a consultant, I managed 50 locations, $250 million in revenue, about 2,000 engineers. And I'm telling you, that consulting practice pales in comparison. It was simple compared to being a CIO for a health system.
This really is tremendously reassuring on days that are hard for me. I'll just remember that I'm playing on a slightly more difficult level, and that'll make my ego feel better.
Well, it's the complexity of it, right? Yeah. So yeah, your first meeting is, you know, talking to somebody about clinical outcomes or setting up a clinically integrated network. Your second meeting is talking about rev cycle. Your third meeting is talking about M&A. Your fourth meeting is with a board member who wants to know where AI is going. Your next meeting is with, with cafeteria staff. They're thinking of a new point of sale system. When you think about the breadth of things you have to be able to talk about, and then it's 7/24, 365, it has to run. Even a bank can go down for a couple minutes, but a health system goes down for a couple minutes. That's problematic. And so there's pressure on that side, the breadth of what you have to know, and be able to context switch at a moment's notice and be current, right? So you're somebody who's going to come up to me and say, hey, I saw this in an article on AI, and I see that generative AI is moving in this direction towards agentic AI. How is that going to be applied to healthcare? And I'm like, you have to be versed on that and ready to have the conversation.
Yeah, it truly is. It's an amazing field. Like, you're never bored. There's always something new to learn, which is part of what I really love about it.
I love your optimism. You're never bored. That's true.
Right?
You're never bored.
It's job security. Bill, tell me a little bit about what drew you to podcasting, and has this transition shaped your perspective on healthcare IT leadership?
Marketing. it took me to podcasting. There was a time where I was brought into a failing data center services company, and they asked me to turn it around. They built data centers for some of the best companies in the world, and that business started drying up because everyone was moving to the cloud, and virtualization was making it not necessary to build data centers. And so I came into some consulting and identified their problems, and then they said, "Hey, can you come in and help us to grow a new line of business?" And so we decided we were going to do cloud consulting. This was back in 2008,
okay,
2007. And we bought a one-person company. This guy had written about 6 or 7 books, was primarily an academic, but had a good name in the industry, did a lot of speaking and whatnot. And we leveraged that to grow like a $42 million business. But the thing he liked doing was podcasts. And so he convinced me that we should do a podcast called the Cloud Computing Podcast. And we did it for about 2 years. And I was the $42 million in business, like a majority of that came from the podcast. And I was like, who knew? At that time, I didn't really know what podcasting was or whatnot. So when I left St. Joe's as CIO, I flew around the country and talked to my peers. I said, look, I have these consulting ideas, I have these product ideas, and I'm also thinking of doing a podcast. And they all love the podcast idea. I'm like, all right, so we'll start that. The first podcast I did was downloaded 27 times, I believe. Mm-hmm. And I think I was half of those. Like I was testing the platform, making sure it worked. You know how this goes. Mm-hmm. You just, did it work? And you're downloading on different things. I think of the 27, I might have been half. My mom was another 2 or 3 or family. But I made a commitment that year. I'm like, I'm going to do it. I'm going to do 52 episodes, and we'll see how it goes at the end of the year. And sure enough, the listens just, went up in a hockey stick. And I thought, all right, there's something here. It really was one of the first podcasts that really focused on healthcare providers and healthcare IT leaders. And it was just like you and I having you were just on my show. It's you and I having a conversation about what you're doing at the clinic and what AI. We had a good conversation around AI, where it's going and that kind of stuff. And everybody I talk to has a little different perspective and whatnot. And we just want to, our tagline on the podcast is amplify great thinking to propel healthcare forward.
I love that. And I think one of the things that really drew me to your podcast, and I have young children, so the amount of like YouTube and other media that is ambient in my house is high. But one of the things that I really love about your podcast is that you are so very grounded in reality and grounded in the mission of healthcare. You talk a lot about the need to connect our IT teams with our healthcare mission. Talk to me about how you learned as a CIO and through your podcast about shaping culture. How do you encourage people to keep that mission front in their mind? And how do you carry this forward into your influence in your work today?
I just completed a podcast with Deborah Proctor. Deborah Proctor was the CEO at St. Joe's when I was the CIO. And Deborah Proctor is a special person. She's now fighting a battle with Parkinson's, and I wanted to capture some of her wisdom. She's long retired. She's been retired since the Providence merger. And I learned so much about culture, and then I just interviewed her again and realized I still have a lot to learn about culture. And she just reminded me of all the things that they did at St. Joe's in terms of understanding Catholic healthcare and its mission within healthcare in general. When we came in, I was put in a group. And that group, we went through understanding the foundation of Catholic healthcare, the mission of the Sisters of St. Joseph, the ministries that they do to the healthcare is considered a ministry for them. So all the hospitals are called ministries. And she so she goes, you came in and you did that. Then when the next phase, I went into a 3-year program, which was a leadership program, which was the next level. Then I went on a pilgrimage to France to follow in the footsteps of the Sisters of St. Joseph to understand what they went through, because people are like, oh, they just wanted to be in $1 billion business. I'm like, no. They were doing healthcare when they were being killed in France for doing healthcare. Mm-hmm. Like it's not like they were sitting there going, oh, look, in America, this is going to be a multi-billion-dollar business. We got to do this. So anyway, that conversation really helped me to understand that, first of all, building culture is intentional. and it's not successories. It's like it's an intentional thing. You have to think about, what is our culture about? What is our mission? What is our vision? What is our values? It has to be thought through. It has to resonate with your team. It has to be something that you see it clearly, you say it often, and you show it creatively. And you're constantly going through it. And then it has to be lived out. It was interesting in that interview with her, she pointed to a couple of key decisions we made while I was CIO. And she said, do you remember we took it through the framework of our mission and our vision and our values? Like, we don't start with strategy. A lot of health systems start with strategy and go, our strategy dictates where we're going to go. No. It's mission, vision, and values, and then the strategy comes out of that. And she showed me how, like, consistently we came back to a framework that reinforced our culture of this is who we want to be about. But she would also say, in that conversation, she would say that without stewards, it goes away.
I mean, I think that's incredibly true. And I feel like it's very difficult as your organization grows to ensure that culture equally permeates all levels of your organization. That's really, really interesting to me to think about how you carry that mission and vision and values forward.
Can I do a pitch real quick?
Do a pitch, please.
All right. So the 229 project, we went into a studio last fall and we started recording some things. We took 3 former CIOs and we recorded about 6 hours of training on selling into healthcare. Mm-hmm. And we created a 229 HCSP certification, and we launched that. There's 120, our initial pilot is 120 salespeople are going through that to get certified, and they're watching those courses and that training and whatnot. The other thing we did is we decided, what does it look like for a healthcare organization? We just try to solve problems that healthcare organizations have. And one of them is the CIOs go, well, we want to invest in our next generation of leaders. And I'm like, you don't have time. You don't have time. So let me help you. And here's what we did. We're creating a three-tiered executive development program. And the first is Certified Healthcare Technology Manager. The second is Certified Healthcare Technology Executive. The third is 229 CIO.
Okay.
The one we recorded in the fall was CHTM, and we recorded 6 hours on leadership, which is a course I do. We did 6 hours on, it's total 6 hours. So I did leadership, and Megan, who is our chief operating officer, did culture. And it's a phenomenal course on culture of honor and how that gets applied to every organization. And then we did a session on teams, how to build effective teams. So that's the Certified Healthcare Technology Manager. And I'm going to look to my left right now because it's all on the board. Certified Healthcare Technology Executive. We're going to have 4 courses: clinical informatics, architecture, IT operations, and IT budgeting. And then the 229 CIO, there's going to be 4 courses: presenting to executives, governance, organizational change management, and project delivery. One of the things I became aware of is we give people these, and I'm, again, for whatever reason we do it, and there's value in it, but we give them certifications and we say, you're ready to be a CIO. And I'm like, no, they're not. They're not ready to be a CIO. But these are the things when I talk to CIOs, I'm like, what's a majority of your job? Like a majority of the job, I say to people, hey, these people are getting CIO certified. And there's nothing on IT budgeting and finance. Let me ask you this question as a CIO. How much time do you spend on IT budgeting and finance? They said 25% of the time. I'm like, so do you think somebody's prepared if they have had no training on IT budgeting and finance? They're like, no, not at all. I'm like, yeah. So we've got to include that somewhere along the line to help people understand it. And an MBA helps, but it's different. It's just different.
So can I ask you to put a cherry on the top of this pitch for me? If somebody were interested in finding these resources, if somebody were interested in these courses, where would they go?
229project.com.
Excellent.
That's where they would go. They'd also see all the events that we're holding. We're doing city tour dinners. We were in Nashville last night. We were in Kansas City the night before. Me, Drex, and Sarah take turns traveling around the country and listening to people like you.
Yeah.
I think we are coming up to Cleveland.
You are indeed coming to Cleveland in, I believe, September is when we're planning it. So stay tuned.
At least it's not January.
Yeah. Oh, yeah. September in Cleveland is amazing. Which actually brings me directly to my next question, because I wanted to talk with you a little bit about the 229 project. How was it conceived and how has it grown? And then I'll pause there and then I have a follow-up question.
229 stands for February 29th of 2020. It's the first reported death of COVID to the CDC. And around that time, my phone started ringing, and it was people saying, hey, what's Vanderbilt doing around drive-through clinics? And what's UCLA doing about work from home? And I'm like, why are you calling me? You should call Neil and you should call Mike. And they're like, well, you're interviewing them, and I don't really know them. They're up on stage. I'm like, I've seen you in the room together. It's like, yeah, but I really don't know them well enough to call them. I'm like, well, we're gonna have to remedy that situation. Not that everybody would know Mike and know Neil when we're done, but everybody should have a group of people that they can lean on and learn from in times like the pandemic, where you can just pick up the phone and say, hey, this is unprecedented. And by the way, there's unprecedented in healthcare all the time, right? I mean, hey, what are you doing around AI? What are you doing around budget cuts? What are you doing around, trying to plan for NIH funding going away? I mean, there's a lot of times in healthcare where you just want to pick up the phone and talk to somebody, and some of that's just commiserating, but some of it is, hey, have you done something? Like, how are you thinking through it? So, the concept of the 229 project came out of that, and what we decided was we're going to put together. We started with an event. We felt like there was room on the calendar for an event where it was just leaders talking to each other, and we facilitated those conversations. So we put people in we call it a round table, but it's really a horseshoe, but they're facing each other, and the agenda is them. It's them talking to each other. So that's where man, we just have great, honest conversations because we give them prompts that don't allow them to be proud.
And this is my follow-up question, right? Getting healthcare executives to have these kind of open, vulnerable, candid conversations is tricky, right? Because you don't get into a leadership position without developing kind of a tough skin and an ability to deflect questions that it's not the right time to answer. I'm curious to know how do you start to break that down and really forge these real connections? What strategies are effective? Have there been things that you have tried that have not worked?
Oh, yes. Well, the first thing we've learned is that the makeup of the table matters significantly. And so our summits are invite only. And people are like, well, you're being exclusive. No, we're making sure that the table is relevant. So having, there are some shared problems that you would have in a single hospital system that you would have with a multinational health system. But the scale and the scope and the budgets aren't the same. So you go to the conference and you listen to the Cleveland Clinic or Stanford or somebody else give a talk, and you sit there and go, well, they're an academic medical center with unlimited resources, not unlimited, but with more resources than I have. With it's just a different ball game. So, but if you could put 15 rural healthcare CIOs in the same room, or CMIOs, CTOs, CISOs, they tend to have similar strategies and approaches to those things. So we find those conversations. They can still hear about what Cleveland Clinic and Stanford is doing. All they have to do is pick up a journal, for heaven's sake, and read about that stuff. But because everybody wants to report out on that, we want to have the discussion. And I'll tell you, man, people have learned. I've learned a ton just listening to people go back and forth, and some health systems have solved problems that others are really struggling with.
That's fascinating. Do you have like an example, like insight or mindset shift that you've had as a result of these conversations?
Yeah, we continue to grow what we're doing as an organization. So we recently had CTOs in a room, and and essentially I said, what's the biggest problem you guys are facing? They said, easy. VMware just upped their price by 600% to us. And that's a rough estimate. Some were like, oh, mine wasn't that bad. Others were like, well, mine was worse. Whatever. Let's just say 600% was the increase. So my CIOs come to me and said, we've got to do something about this. Like, this is a problem. And so we as a group sort of sat there and started coming up with, what are the alternatives? Where would you go? How would you? And it was a really good conversation, and hopefully move the ball down the road, or ball down the road, car down the road, ball down the field, whatever. But we moved it down the field a little bit, and that group continues to have conversations with each other and go back and forth. Yeah. But where that takes us is the next thing we're talking about doing is insights and solutions. That is health systems coming together to work together to find solutions to a common set of problems that they're facing. So I think that's the next big thing we're being asked to do, and I think we will do.
Yeah. So final question. We're on my podcast, which is centered around health data and ethics. And in this digital space, we've spent a lot of time in the past few months talking about healthcare and AI. You've also covered AI extensively in your work. So I'm curious, where do you see AI making the biggest impact in healthcare? What should CIOs and CTOs and other IT leaders be focusing on right now to prepare? And then 3, what feels like hype to you and what feels real?
How much time do I have to answer this question?
I mean, this recording will roll for as long as you want, so go ahead.
All right. So the biggest problem we have to solve is a physician-clinician shortage, even tech shortage. I mean, we have a shortage of people to do the work that needs to be done. And so AI is going to make everyone who's in the system more effective. If that's ambient listening and documentation, that's one way. And that has finally hit its inflection point. Every health system is implementing it as far as they possibly can. Plus, it's moving outside of just primary care and moving into some of the specialties. So you're starting to see that have an impact. You will see that start to go from just collecting and creating a note, which is table stakes, to actually making that data more valuable, because quite frankly, clinicians aren't great documenters. I mean, having worked with the data over the years, I hope I don't get angry emails, but having worked with the data over the years, we document things so differently. Well, this will hopefully standardize that documentation and make things a lot better. So we're going to make them more effective. We have to figure out ways to provide care to people who don't have access to care, right? So we have a rural healthcare crisis. We have rural health systems that are going to be closing down. And now you're talking about people driving an hour and a half, 2 hours, that kind of stuff. I myself, I utilize telehealth all the time, but telehealth is just the first, telehealth is still person to person. I think we will see tools. And by the way, it's just like when Google came out. Like, people are like, oh, it gives bad information. I'm like, it might give bad information, but that's where people are going. So at the end of the day, you might not like that AI is giving bad healthcare information, but when they get sick, they're pulling up ChatGPT and they're pulling up Claude and they're asking it questions, and this is what they're doing. So let's figure out a way to make that better. And in fact, what I say to CIOs is, you should have your own persona and your own AI and be building, depending on the scale of the system. But a Cleveland Clinic, you should be building that out. You should be building out the tools that are going to be clinically validated by the Cleveland Clinic and provide answers that you feel good, because your brand matters and it's a good brand, and your AI tools that support that can't be generic. They have to be Cleveland Clinic grade tools, and I'm not sure how you do that without building it out. Now, if I'm a single hospital system, I may not care. I'll just use yours because I might use yours or a competitor's or whatever based on brand and quality that you can build. But I believe your AI tools will now be an extension of your clinical care, and you need, for CIOs, I'm saying you have to be thinking about this, because that brand's going to matter. There's going to be more consolidation over the next couple of years and fewer health systems, and we are going to compete on those kinds of things. And you're going to have people in your market using the other clinic's brand to get health care if you don't build out your digital brand and make that available elsewhere.
Yeah, thinking about digital tools as an extension of your brand is a really powerful way to frame it. That's really interesting. Did we cover what feels like hype and what feels real, or is that? I mean, do you want to have a safe space to make a statement that might not age well?
Oh no, there's tons of hype. Most of the hype centers around people who are taking Gen AI, putting it in their tool and saying, look, isn't this transformative? It's not. So it's cool, it's neat, it's fun, but it's not transformative per se. Gen AI does some amazing things, and I think we will see it continue to get better. The thing I want to see Gen AI really tackle is summaries. You have these really complex patients. I'd like to, with 100% accuracy, have it go through. I've talked to patients who have like 3 volumes of documents. I'm like, why do you have those binders? I mean, in today's day and age, we can share that information. They're like, yeah, but I take my child here, and then I take him over here, and I take him over here. You'd be surprised how many times I have to go back to these binders and show people things.
Yeah.
I'm like, the clinical summaries, like even just scanning those in and having AI go through it, because I'm looking at those binders thinking, all right, I'm just reading the Einstein biography. It's going to take me a month to read the Einstein biography. I can't imagine a doctor honestly looking at somebody and saying, yeah, I'll review those 3 binders and make sure I know everything about your child before we make any determinations. But Gen AI can do that, and it can do it really effectively. We just need accuracy.
Well, and the ability to sort of switch context and switch roles, I think it's so close there with the technology. To be able to read through those 3 binders as, a rheumatologist versus being able to read through those 3 binders as an orthopedic surgeon, that's going to need different information to be prioritized. And I do feel like the technology is very close to being able to do so effectively and accurately.
Yeah. By the way, the biggest change in AI is it's going to give us the ability to rewrite interfaces to back-end data like in hours instead of waiting for a vendor. We could have the potential for a renaissance in healthcare IT if we really tap into the fact that with some of these tools we could rewrite interfaces. We could write an app literally in an afternoon for some use case that we just dreamt up at lunch.
Yeah, it's such a powerful feeling. It's so exciting. What a time to be alive.
It is.
Bill, I always end these interviews with, is there anything you want to answer that I haven't asked you? Is there anything that you wanted to say that we haven't had a chance to touch on?
No, I use that question too. And I've been surprised from time to time. People will throw something out at the end and I'll go, man, I really should have asked that question. That's really good. No, I love the fact that you're doing this. People will say to me all the time, it's like, do you worry about other podcasts and competing? I'm like, no, I don't. Not at all. I mean, there's so many areas of healthcare to touch on and to cover. I try to stay in my swim lane which is the intersection of technology and healthcare. And I tell my team all the time, I'm like, stay in that swim lane because that's where our value is created. Nobody's tuning in to hear what I have to say about what the government's doing with regard to whatever. Mm-hmm. I can talk about it, but that's not why they're tuning in.
Right. I have lots of opinions, but they are, like 70% informed, and they're not the kind of nuanced take that you're going to get from somebody who lives and breathes that all day, every day.
Yeah.
Bill, thank you so much for coming on this podcast. As usual, this is an amazing conversation. I'm so glad it got captured for posterity. And I cannot wait to see where the 229 project goes next.
Yeah, absolutely. And don't forget to check out Jennifer Owens on my podcast because we did 45 minutes.
Yeah.
It's awesome.
It's fantastic. Thank you so much, Bill.
Thank you.
And